I love this because I love AI as well as trends in plastic surgery. So overall, I was like honored and excited to talk to ASPS about this. I think a lot of plastic surgeons would give very similar answers to me. I think that, the ability to manipulate our own body's tissue, like your body, my body, is going to be the future. Because technically, we all know that stem cells are like the grandfather cells. In the right, with the right recipe, stem cells can turn into muscle or bone or whatever. If we can manipulate that, where we can actually help collagen to grow, we can actually help your facial skin to look better. If we can actually improve not just like fat viability today for breast and body work, for breast reconstruction or even breast rejuvenation, we're actually able to increase normal cells just to make yourself look more aesthetically pleasing. That's the future because it's your own tissue. Right now, we actually can't give a lot of volume with fat grafting to the breast. Having said that, a small amount of volume may be enough for some patients. We are going to have better surgical techniques to preserve more fat or place more fat during fat grafting. We already have the internal bra, very early stages, but technically it's bioabsorbable. There's experimental stuff from a couple different companies on a bioabsorbable scaffolding for your breast. And so that's being used. They want to use it for breast reconstruction, but obviously it could be used for aesthetic breast rejuvenation. And I definitely think that men will, if they want to, spend the time and the money to get the best results. If you want to look ripped or very good for your entire life, it's definitely possible because Ozempic allows you to keep that weight off. And then fat injection into your actual muscles, that will help you maintain definition and strength. And so this should also translate honestly into a higher quality of life where we're stronger, more mobile going into our 50s and 60s and 70s and even 80s. Regenerative medicine, if we can regrow at least maintain the collagen as we get older, your skin's going to look better. With nanofat facials, which we're already doing now, we liquefy your own fat and then we place it like with tiny needles in your face. Your skin looks better. It actually gets rid of dyschromias or discoloration. Like your skin gets a more even skin tone overall. It helps with fine wrinkles. And it's like, you're kidding me. We're injecting liquefied fat into your face. It works. It's needleless injection, like truly needleless. So they use sound waves. It looks like a gun, sort of like a handgun. You put liquid in, you press a trigger. It uses sound waves to deliver the liquid to a depth that you want, typically just underneath the skin. And then the liquid sort of spreads out. The patient's skin doesn't have needle marks.